Hello, everyone, and welcome back to Let's Eat. Today, we are welcoming Brianna De la Cruz to the podcast. She is local to the area, which I love connecting with local practitioners and wellness oriented individuals to discuss their work and their passions. And today, we're talking to Brianna all about her work as an eating disorder registered dietitian. Now, for those of you who don't know, I worked in the mental health field for a little while, and my internship was at a private practice in New Jersey that had a couple eating disorder specialists on staff. And at the time, that was the direction that I thought my career was headed in. I thought I was going to pursue eating disorder care. And so getting this hands-on experience with other clinicians who specialize in this field was helpful for me to determine my path, which was obviously, in fact, not eating disorder care. It wasn't the mental health field at all. So, spending time chatting with Brianna kind of brought me back to that because what a lot of people don't realize is when it comes to the world of eating disorders, there are specific registered dietitians who focus on eating disorder care specifically because of the complexity and because of how it differs from the work that they do normally in their own arena of dietetics. So, talking with Brianna, it was really special because I got to hear her side and share on my experience coming from the more clinical side of things. Now, I never actively worked with eating disorder clients. I worked collaboratively with other therapists in that process, but I still got that firsthand experience. And I also got to connect with other RDs who specialize in eating disorders as a means of collaborating and working together on certain clients' care, which is so incredibly valuable. We touch on this in the episode where we emphasize how synergistic it is for, say, the psychiatrist, the therapist, the RD to come together in a collaborative manner in order to best support the client that they're working with. And I think this is a major disconnect. And so it was refreshing to be able to discuss this with Brianna, who appreciates it as well and is proactive in prioritizing it. So, Brianna founded her company, Nourish and Flourish Nutrition Therapy, LLC. She is a registered dietitian with both a bachelor's and master's degree in nutrition from Rowan University. And within her practice, she specializes in intuitive eating, chronic disease management, body image healing, and sports nutrition. So, I will put all of her information in the show notes if you want to connect with her. But thank you so much for being here. Let's welcome Brianna De la Cruz to the table and let's eat. Welcome to Let's Eat. I'm your host, Emily, certified holistic health coach, functional nutrition expert, and self-proclaimed wellness enthusiast, here to meet you at the intersection of physical and mental health, the space within which we become well. This podcast is meant to explore all areas of mind and body wellness, designed to offer you the integrative knowledge, behavioral strategies, and mindset shifts necessary to uplevel your health and feel better today. We'll explore nutrition, sleep, movement, self-care and stress management, habits and routines, self-development, gut health, mental health, and more. I am so happy that you're here. Welcome to the table. Let's eat. Hi, Brianna. Thank you so much for joining me today. I'm really excited to touch base, to hear a little bit about your work and, kind of share with the audience what exactly it is that you do.
Yeah, thank you for having me.
Yes.
So I'm a registered dietitian. I am private practice and I primarily focus on eating disorders and kind of intuitive eating. I do like to work with hormone health as well, but primarily eating disorders is what I do. So I do one-on-one counseling.
Okay. How long have you been working in the field?
So I've been in the field. It's a good question. I think since 2021, 2022, I believe. So I'm a little newer into the field. And when going into the field, I did not want to work with eating disorders at all. It was
Okay.
not something that I thought would be enjoyable for me. And when I started working more with eating disorder clients, it became like my favorite thing. And
Okay.
then I ended up building my own practice because of that. I started my practice a year and a half ago.
Yeah, I love that. Isn't that so fascinating? We go into things and we're like, I would never, that's so not me. And then we start doing it and we're like, wait a second, I'm kind of into this and I'm also kind of good at this maybe. And maybe
Yeah.
this is where I'm meant to be, you know?
Yeah. Said I
Yeah.
would never do it. And now my whole practice is primarily eating disorders.
Okay. Yeah. So tell me about your schooling and kind of the progression of that journey.
Yeah, so I went to Rowan University. I knew I wanted to be a dietitian since I think like sophomore year of high school. I remember like going home and telling my parents like this is what I want to do.
Yeah.
And I looked at a whole bunch of different schools, and Rowan had a newer program, but it was coordinated. So basically, with a dietitian, you have to do your bachelor's and then also now get a master's.
Okay.
At the time, you didn't have to, but it was coming up, so I didn't want to be behind. And then
Yeah,
you
of
have to get
course.
yeah, then your internship and sit down for your exam. So I went to Rowan for all of it.
Cool.
I went to Rowan for my bachelor's, my master's, and my internship, and I did it within like a 5-year program.
Okay.
And yes, and I also ran there as well. So that's like I
Oh,
feel like one of the
cool.
important things. I ran cross country and track there. So
Yeah.
yeah,
Okay. Very cool. Very cool. So you went into it knowing and you, I guess because when it comes to something like it's kind of like a 4+1 program, essentially, do you have to know that you're going to do that going into it, or can you pivot? Because it
yeah,
sounds like it's probably a pretty like structured program, like to
yeah.
get it done in 5 years.
Yeah. So, I had a whole bunch of issues because I went in doing it and also wanting to do the honors college. And like, it's so structured that like you can't deviate from classes without
Yeah.
taking extra. So, like, I had some where I was taking like over 20 credits or like
Oh, wow.
taking summer courses or things like that to get everything and to hit my honors requirements, but
Okay.
also graduate in five
Yeah.
years. And you had to apply your sophomore year. So,
Okay.
you go in with the idea that you're going to get in. And then you apply your sophomore year and really, really hope that you get in. Because if not,
Yeah. Yeah.
if not, the options are, wait a whole nother year and then now be in school longer, or transfer, or change your
Sure.
major, or
Sure. Yeah.
yeah,
Yeah.
yeah.
Okay. Interesting. So tell me about, I'm very curious to know what you went in think, or you said you wanted to do dietetics, and then how did the transition kind of happen when eating disorder work kind of became something that you were interested in?
So I really wanted to eventually start my own practice, like way down the line. It was not something I wanted to do right out of college. I wanted to like kind of wait a little bit.
Sure.
And so I also didn't want to settle for work I didn't want to do, which so like I got a whole bunch of job offers in long-term care, and I really did not want to do long-term
Yeah.
care.
Okay.
So I ended up taking like a per diem job at long-term care and then got hired at a private practice,
Okay.
and I was so excited. And so I started working there, and I was there for a decent amount of it, and they taught me a lot. And part of it was I was ended up covering maternity leave for one of the dietitians that was there,
Okay.
and she saw a lot of eating disorders, and so they kind
Mm.
of just put the eating disorders onto me, which I was very nervous about
Yes,
because
of
I was not
course.
something I had any experience with
Yeah.
prior.
Yeah.
Um, and I had one client who has been discharged since, but she like I remember meeting her and like us just like connecting, and my like there was like something inside me that was like I want to help this girl because she was
Yeah.
like very confused and not know she had an eating disorder,
Yeah.
just looking for some sort of help.
Sure.
And like I adored her, and I was like, like this is kind of interesting because it's not like I was kind of feeling burnt out with people who are just coming for weight loss, or coming because they want to get rid of X, Y, and Z. Like these are people who just want to learn about nutrition
Yeah.
in eating disorders. And I liked how it was more like, how is food helping you? Like I remember this girl she was very worried about having sweets and desserts at night. And so we were reframing it like, why don't we start with like avocado truffles, like when you do the avocado with
Yeah.
like the chocolate, because
Yeah.
it has magnesium, and
Yeah.
magnesium is great for relaxation and it's
Yeah.
great for
Yeah.
sleep. So like, can we try doing that at night? So it's like a spin that kind of helps her mind feel a little better about what she's doing, and like
Okay.
teaching about like how is the food helping you versus what do we have to take away to do like this and that. So
Yeah. Okay.
she really changed my whole view on all of it. Um,
Yeah.
And she knows that. I definitely have accredited to her the reason why now I have my own
Yes,
practice.
I love that. That's so inspiring, you know?
Yeah, and of
Yeah.
course, since then, I've taken, like, I got more and more people, and so I got a lot of training at that other practice that I was at, and
Okay.
I loved it. I was like,
Yeah.
this I looked forward to it so much more than some of my other people that, like,
Yeah.
I'm not very diet culture-y, and so
Yeah.
sometimes people are, and I looked forward to kind of getting to talk to it was a lot of young females mostly, some
Mhm.
males as well, but I look forward to, like, talking to them, and so I'm like, "This seems more like what I wanna do."
Yeah, yeah. Oh, I love that so much and that you kind of stumbled into it. So, I know for me when I was working in private practice and I guess even before that working at a private practice as an intern, I was kind of drilled into around how delicate eating disorders are and how important it is to be really formally trained in that department. So I'm curious what your experience was like going into this, kind of with the expectation that you had to start working with this population and feeling like, okay, but I've never done this. I don't know if this is for me. This feels a little cumbersome and overwhelming. And,
Yeah.
just a little bit more about what that initial experience was like for you because of how sensitive this
Yeah.
topic is.
So when I first got hired at this other practice, they did not tell me I'd be doing anything with eating disorders. In fact,
Okay.
they told me I specifically would not be doing anything with eating disorders
Okay.
because they were like, "You need special training," which we can
Totally.
do.
Yeah.
Yeah, and they I didn't have the best experience at that place, which is why I ended up leaving and starting my own.
Okay.
But they kind of threw me in. They were like, when this person left on maternity leave, they were like, we are going to find another dietitian to cover the eating disorders. We're not sure who yet, but we're going to send someone else. They
Okay.
didn't, and they put them on to me.
Okay.
And so the RD at the time was like, I believe that you can do it. You'll be fine. And I
Yeah.
did shadow a little bit.
Okay.
But it wasn't until I met that one client. It was very early on, probably in the maternity leave. And then I was like, okay, like I need to do research because
Yeah.
like I have no training in this. And like with a lot of it, I kind of was just thrown in and they kind of just left me on my own because it was basically me and one other RD at this place.
Okay.
And I was trained for a few months and then they literally just kind of like threw me in and then she left on maternity leave, which I didn't know I was hired to cover maternity
Yeah.
leave. And so now my only other dietitian is gone. It's just
Yeah.
me.
Yeah.
So I bought like every book and then I started watching like all the
Yeah.
CEUs and
Yeah.
like I still do this to this day. I feel like the only books I read now are like eating disorder dietitian
Yes.
books.
Yes. I relate. I relate to that. Yes, totally.
And it became like a very like an obsession in a sense where I'm like, I
Yeah.
just want to learn more. I want to know how I can help.
Yeah.
And so then I started doing more continuing educations and
Yes.
kind of training myself because
Okay.
I'm my job didn't really give me a choice in whether
Yes,
I was
sure.
going to be working with this population. So I'm
Yeah.
like, might as well figure it out myself.
Yeah, yeah, yeah. Okay, well, good for you. And I never want to come across as though I was implying that you were unqualified, but I also just know
Yeah.
the depth, but
Yeah.
of that type of work, and also how different it is from someone like you said before, who's maybe coming for weight loss or whatever the case
Yeah.
is, and so that probably felt very heavy for you. But it sounds like you really said, "All right, you know what? This is what I have to do. This is what I'm expected you to do. So let me go ahead and teach myself and learn and
Yeah.
grow through it, as opposed to kind of panicking and feeling like,
Yeah.
okay, well, this isn't for me." It sounds like you grew to love it, and then you also just decided, all right, this is the route I'm going to take. So let me immerse myself in all of the things that are there.
Yes, and it made me feel better a little better too because for a while I'm like, okay, I'm some imposter because I
Yeah.
don't have a lot of formal training because I feel like there's not a lot of formal training in eating disorders.
Yes.
And so, but when I took a job also part time at Hunter and Healthcare, some one of the other dietitians there was like, yeah, there isn't really any training. It's kind of like you train yourself, you work with
Yeah.
it, you get the
Yeah.
experience,
Yeah.
and
Yeah.
kind of yeah. And so it was definitely, like, a big learning curve, but even still
Yeah.
to this day, like, every time I go to, like, Barnes& and Nobles, I'll go into, like, the nutrition section, and I'll,
Yeah.
like, look for, like, any sort of, like, eating disorders or, like, even, like, psychology books, which obviously not a
Yeah.
therapist, but it's interesting to, like, learn about and see, like, how more can I at least be assistance or, like, understand.
Totally. Yeah, without a doubt. Yeah, I couldn't agree with that more. I think just being able to continue to grow and understand and learn more
Yeah.
just will make you a better clinician and dietitian and so forth. And It's fascinating that you say that because I feel like in my search, when I was looking for, well, first and foremost, I'll say in my graduate program, eating disorders were barely touched on. And I went
Mhm.
to a university to become a mental health clinician, right?
Yeah.
So, from my recollection, I don't think it was touched on that much. And even remembering back to conversations I'd have with my advisor when I was trying to figure out what I wanted to do and where I wanted to go next, the conversation largely centered on, okay, well, you're going to have to go get a certification for ED because of the fact that there isn't a whole lot of education. And you also need specialized training to work with this population.
Mhm.
And then following my program, going into an internship before graduation, I was trying to find somewhere that I could intern for this specific population, but a lot of it was residential and a lot of
Yeah.
it was inpatient. And so I think to your point, outpatient isn't as accessible, and I get it because the severity of ED is pretty intense, and so a lot of individuals do require inpatient. But when I found the practice that was outpatient for ED and obviously other coexisting disorders and so forth, I was shocked because I couldn't, and I don't know if things have changed in the past several years, or maybe I was just looking in New Jersey, so who knows what it is nationwide. But I know from my experience, it just didn't seem like the help was there. So I'm wondering your thoughts on that, seeing it from your point of view.
Yeah, I would agree. Even what you were saying for like when I was doing my own clinicals, whenever there was someone in the ED population, they'd be like, okay, you can't shadow, you can't sit in,
Yeah.
you shouldn't work with them. Like they would just kind of like put a I don't know, a barrier in between to
Yeah.
be like, you can't get the experience because that's like either they would tell us it's out of our scope or it's
Mm,
out we had one person in the hospital, I remember that a lot of mental health issues going on, but she was someone who a dietitian had to go see just to check on, and also was eating disorder, and they were like, nope, that's primarily behavioral health, like don't we're just
sure.
not one of the
Yeah.
dietitians, not the one of the interns, one of the dietitians check on them and then move on, which I understand. At the same time, like I feel like how are you going to learn unless like
Yeah.
you're working with that population?
Yeah, totally.
And even to find other healthcare, clinicians that are either eating disorder informed or work
Yeah,
with eating disorders is hard because like I get nervous to send my patients to certain doctors because I don't know
sure.
how the doctors are going to talk to them.
Totally.
And
Yeah.
then same with like therapists, where I've had some therapists say some things that I'm like, you shouldn't be saying
Yeah,
that
yeah,
to
sure.
my client. Like I once had one that said that, okay, if you just exercised more versus ate less, we
Oh,
wouldn't be in the situation. And I was like, that's not
no.
true. I'm like,
Run
either
the
way,
other way.
yeah,
Run the other way.
I would
Oh,
end
I
up
hate
not.
that. Yeah.
And so like it's hard to find who to trust. I think that there's more and more popping up, but it's also like it's very rare to find other healthcare clinicians that either take insurance and
Yeah,
then also work with eating disorders and are
sure.
willing, like in the outpatient setting, it's very, very hard.
Yes. Yeah, totally. And I know from my experience in private practice as the intern, we only referred to ED specific dietitians. And that was something I learned that even existed. I didn't even know that
Yeah.
existed when I was in practice. I was like, oh, that's interesting. But then it makes complete sense. And
Yeah.
I think something else I have a huge problem with while we're on the topic of kind of access and,
Yeah.
limited individuals who are qualified, I think what I'm really seeing, and I'm sure you see this too as being an RD, the influx of coaches. And obviously, I'm a coach. I don't qualify myself as an eating disorder coach because that's not what I do. But there are individuals who are inappropriately working with clients on issues
Yeah.
very reminiscent of disordered eating, ED. And I think my red flag goes up because I know how important it is to have specific training in that department. And yet now, and this isn't just for ED, this is any mental health issue. It
Yeah.
frustrates me because I think that you are missing a whole bunch of understanding by just getting a certification as opposed to an actual qualified degree to work with these types of populations. And yet it's happening left and right. And I think specifically in the ED population, I think that is very worrisome to me. What are
Yeah.
your thoughts on that?
Yeah, I definitely agree with that, and especially with things with social media now as
Mhm.
well, because I just hear all the time these people talking to me, especially my ED patients coming in and now have a fear of this new thing. And I'm like,
Yeah.
where did you hear about this?
Yeah.
Like, and it's because someone is, yeah, a health coach or a nutritionist or something else online, like saying this information, and we're not checking our resources and like what are their certifications and
Sure.
like what is their health background.
Yeah.
And like we're
Yeah.
just trusting anybody who says
Yeah.
anything.
Yeah. Yeah.
And
And I'm sure they mean well, right? It's not
yeah,
saying you have to, you're a horrible person for doing it, but I think being an anxiety coach or a body image coach or anything of those titles, you really have to kind of call into question, well, what is their qualification to call themselves that? Because yes, a lot of people need help, but it can also do a lot of damage and a lot of harm
Yeah.
when they're going out and doing work that they're just not qualified to do.
Yes. Yes, I agree.
Yeah.
Even I have one person that I'm not a GI specialist. GI is like my strong suit, and I have a disordered eating patient who needs a GI dietitian, and I'm like looking to find someone who's also just eating disorder informed because like
Yeah.
you could do a lot of harm without realizing it
Sure.
with having good intentions, but if you
Yeah.
don't have the background and don't have the knowledge, then like sometimes you just say the wrong thing or don't,
Yeah.
and it can cause
Sure.
harm.
Yeah, without a doubt. Without a doubt. And I think it has to be very specific when you're dealing with an issue that is of that level. You know,
Yeah.
it's a very, very, what's the word? It's a very, I don't want to say sensitive, but it's a very intense area of mental health that needs to be handled in an appropriate way, and someone needs to be qualified to handle it. Yeah, I completely agree. So I'd love to dive into your work with the eating disorder population. You know, what types of issues are you seeing? What types of populations are you seeing them in predominantly? You know, kind of give us the background on your work and what it looks like.
Yeah, so I see most all eating disorders. I think the only one I haven't really seen is like pica. But I see a lot of ARFID, a lot more ARFID recently. I feel like has been kind of coming up.
Can you
Uh,
explain what that is for anyone who
yes,
doesn't know? Yeah.
it's avoidant restrictive food intake disorder is what
Okay.
ARFID stands for, and it's kind of like a very extreme picky eating where I feel like it's more than just picky eating. It's kind of more, it depends on the person. There's three different branches of it too, where some of it
Okay.
can be like contamination. It can get often mistaken with OCD.
Okay. Yeah, I was gonna say it gives OCD, yeah,
Yeah,
energy. Yeah.
yeah, and but a lot of those with texture, sometimes the fear of like throwing up, the fear of choking, and it can lead to like extreme picky eating. So it's more of the picky eating versus ARFID. I feel like would be like ARFID is more okay. You only eat this one brand of cereal from this one store, and like they can tell if it's from like a different store, or they only eat this certain brand of chicken nugget, but only that one. But they will not have any other. Like it's
Okay.
very selective, and it usually is they're only eating like I don't know. Sometimes I have severe ones that sometimes only like 5 foods that they
Okay.
are comfortable with eating,
Yeah.
and it can lead to a lot of nutrition deficiencies and
Of
a lot of
course.
just issues. And then also with socially, it can make it hard for them to like go out to eat or
Totally.
like hang out with friends or have dinner with their family or holidays. Like it can
Yeah.
make it very hard. So I see a lot more of that now than
Okay.
I have in the past. And I see, yeah, pretty much everything. A lot of like orthorexia, anorexia, you know, binge eating disorder. Not
Okay.
as much bulimia, but here and there bulimia, but just pretty much all of them. And
Yeah.
my population I work primarily with, or that I'm seeing the most of,
Yeah.
is usually like high school or in like early college,
Yeah.
and like 50% probably athletes, and then like 50% non. And I do have mostly female, but I do have some guys that are like sprinkled in there.
Okay. Yeah. So younger populations, it sounds like mixed athlete, non-athlete, but predominantly female.
Yeah. Mhm.
Okay. Yeah. Interesting. So tell us about, I want to really open the floor for a conversation around orthorexia
Yeah.
because I personally think that this is something that's becoming much more mainstream.
Yeah.
I'm hopeful that it becomes a part of the DSM at some point
Yeah.
because I think it's important to be part of the DSM because
Mhm.
of how common it is. But I'm curious to know what that looks like in the work that you do. How do you navigate that with clients? I think we could talk for hours about social media
Yeah.
influencing it and fueling that fire, but curious about what your experience has been like with it.
Yeah, so I describe orthorexia as like the obsession with eating healthy,
Mhm.
and everything has to be clean and eat like clean, quote
Yeah. Yeah,
unquote,
yeah, yeah, yeah.
in this sense. And it's a lot more prevalent, I feel like, than it has been in the past. And it can be kind of fun, I feel like, to work with in the sense that like they're more willing to learn, I feel like, about kind of nutrition because that's
Okay.
kind of their obsession is with
Yeah, yeah, yeah,
nutrition.
yeah.
It's hard with social media because I feel like social media, especially with things with seed oils
Yeah.
and, all of these different seed oils is the main thing that comes to my mind. But
Yeah, sure.
all of these, like why carbs are not good, and things like that, that
Yeah.
like it's kind of, I feel like, a lot of black and white thinking sometimes,
Yeah,
and
yeah,
trying
yeah.
to work on, like, okay, yes, you that might not be healthy to have every single day all the time, but it's more unhealthy to, be restricting so much that, like,
Sure,
we're underweight, or it's more unhealthy to, like, isolate from your friends because you don't wanna go
sure.
out with them to McDonald's every now and then.
Totally.
And yeah, I definitely am seeing a lot more of it as of recent, and especially too, a lot of time with orthorexia, I see like the presentation of their food kind of where
Okay.
it has to be looking perfectly. It has to be looking like aesthetic
Oh.
and perfect. And so
Mhm.
that could look more like, okay, we don't care if our meal is only one color and ugly
Yeah,
and all mixed together. Like it's
yeah,
still gonna give you what it needs to give you. And a
yeah,
lot of it, I feel like I'm pretty sure with all the eating disorders, except for maybe ARFID, is kind of breaking it down into like what is the food, what is it doing for you, and like what's
yeah,
the actual truth behind it versus
yeah,
like seed oils. They're not gonna harm you.
yeah, yeah.
If you're having them all day every single day and like taking shots of it, okay, maybe that will be an issue.
Yeah, 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 yeah.
Like, if you occasionally you go with your friends to get, like, some fried french fries, like, that's not gonna hurt you.
Yeah, yeah, and that's gonna benefit you more because you're spending time with friends and the people that you
Yes.
love than the stress that comes along with avoiding the french fries or
Yes.
whatever the case is. Yeah.
Yeah.
Yeah, I appreciate that. I think I love the fact that you really educate about what the food is bringing to you, which is something that I really try to do, is start to reframe from what we see in, I know you mentioned before, kind of diet culture or in just growing up with the varying mixed messages that we've gotten, especially as women, around fat and protein and different vegetables and so forth, and really trying to de-escalate a lot of that, and then just educating on what is fat bringing to the body, what is protein, and trying to really kind of shift the mentality, shift the mindset, because it is very indoctrinated from our culture and the way that the food industry promotes food, and the media, and especially now with social media. I mean, I'm not surprised that you've seen an influx in orthorexic behavior because of the fact that social media, I mean, every other video or post is about what you should be doing, what you shouldn't be eating,
Yeah.
what whatever. And it's like, holy, and luckily I feel grateful that I have the wherewithal to separate from it, because
Mhm.
I feel like I have my beliefs about nutrition and I operate the way I do. I know what makes me feel good, and I at least have education in the department of food that I
Mhm.
feel a little bit more qualified, not necessarily to say that that person's wrong, but just to know what I believe is what I believe, and I have research to support what I believe, and everyone's entitled to having that belief system, right? You
Yeah.
can believe what you believe. I mean, that's why certain people believe in the carnivore diet, other people believe in plant-based diets. It kind of all varies, but someone who is just a consumer of this information can certainly feel very confused, and it can become a very big issue when it comes to the way they eat. And I think we have to be willing to kind of delineate and put some separation between the two,
Mhm.
so that we can make a choice that's best for us and not let it become something that's obsessive or controlling, or
Yes.
fill in the blank.
Yeah, like, I feel like it's definitely becomes an issue when it's taking over your life and
Yeah,
interfering with, like, your social life or interfering with your day to day, where, like, if you go somewhere and the only options are maybe things that are not organic, or, maybe it has something that has, like, a seed oil or something that you're not comfortable with in it, or it's like a nightshade, like, being comfortable with, okay, like, that's what we have and it's not
yeah,
gonna hurt you to have it, like, every now and then, it's all in moderation, and,
yeah,
like, it's not black and white, like, we're not
yeah,
thinking only one way, and I think
yeah,
online it can be really confusing, especially for like the younger population, because they don't always, like we are talking about before, have like the background to kind of filter through and know who and who to not trust.
yeah,
If they see someone on social media that has tons of likes, like why
yeah.
should they not trust them?
Yeah,
Mhm.
sure. Sure, totally. Absolutely. Yeah. I couldn't agree with that more. So, I'm curious to know about your experience in the field. Are you always collaborating with a therapist? Do you do more isolated work? What does that look like when it comes? I'm sure there's no one size fits all to it. Every person's different, every client's different, but
Yeah.
what does that typically look like for you?
So for all of my eating disorder patients, I will say require, but don't always. But if they don't have a therapist, I'm not going to drop them, but I'm going to help them find a therapist.
Okay, yeah.
So I would like all of my eating disorder people to have a therapist, just because I found that it's not as productive sometimes, because
Sure.
sometimes they'll kind of confuse it and feel like I'm their therapist.
Yeah,
I'm
I was actually gonna say, I'm sure that happens a lot.
Yeah,
Yeah.
yeah,
Yeah.
I'm not qualified for that, and
Yeah.
I'll make that very clear. I'm like, "Okay, I'm not qualified to give any, mental health advice. I just focus primarily on the food." And so I do try to make sure that they have a therapist. It can be really hard to find, like, a therapist that works with eating disorders,
Yeah.
and a lot of my eating disorder clients do not have eating disorder therapists just
Okay.
because it is hard to find,
Yeah.
but yeah, I do collaborate a lot with the therapist that my clients are seeing. Like, we do
Yeah.
collaborate a lot to make sure, like, depending on how they're doing, of course.
Yeah, yeah, totally. Yeah, I'm not surprised by that at all. I remember very distinctly that level of collaboration because I think it goes both ways, where with the therapist, there can be talks of nutrition, and then with you, there can be kind of this blurry line where you kind of become that role, which you know you're not qualified for, and you try to set that boundary, but having someone there to be like, this is something you can talk to so and so about, or let me touch base with them. I think that that's huge, having that collaborative relationship so they're getting support in both areas. Because I think too, and I'm curious to hear your take on this. What I learned very naively when I first started school and as I moved through school is the fact that eating disorders are really not about the food. It's
Yes.
about a coping mechanism. It's so much more mental and emotional than it is about the food per se. And
Yes.
I think that's where I decided to essentially transition because I went into grad school thinking, okay, well, I'm passionate about nutrition and I have a background in psychology, so why don't I marry the two and work with an ED population? And obviously I learned, yes, food is obviously the main focus there, but it's not really about the food. It's about what else is going on too, right? So I'm wondering, I don't know, your thoughts on that, how that manifests in your work, any insights on it, just because this was something that this is a big part of my journey, was pivoting from what I thought I wanted to do to what I actually wanted to do.
Yeah. Yeah, I definitely noticed that too, depending on the client, but sometimes my clients have, like, my business number, so they can text me if they're kind of, like, struggling or if there's something else
Yeah.
going on with their food, if they're, like, challenging something and they're, like, having stress about it, and I have noticed sometimes that, like, when there's certain challenges or, like, when sort of more restriction sometimes comes on, especially for my restrictive clients, they it can often be tied to, like, other things going on,
Sure.
and when I notice that, I will sometimes bring it up and then say, "Okay, like, we're not gonna really touch on it here."
Yeah.
But I was like, "This is kind of something that I've observed, like, let's talk about it with your therapist."
Yeah, sure.
'Cause, like, I definitely like, when that comes up, I'm like, "Okay, I do not know how to deal with that. I'm
Yeah.
good with the food."
Yeah, yeah, yeah.
But yeah, so I have noticed that a lot with a lot of them. It seems like it is more of, like, a coping mechanism, and
Yeah.
so that's why I feel like it's really important to have both, because if their mental health
Sure.
is struggling, then, like, how can their food be anywhere where it's, like,
Yeah, 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 totally. No,
yeah,
totally. I think it's about the control. It's about,
yeah,
you know, I mean, like you said, it's the coping mechanism, and I
yeah,
think obviously, like you said, it's varies for each client, but I think so much of it is emotionally rooted,
yeah,
and so I that puts you in a even greater position to have that collaborative relationship, because then you can have that open line of communication with the therapist about, okay, we're working on these more tangible behavioral steps, but when it comes, or I guess I wouldn't, maybe I guess it's behavioral, but when it comes to like the emotional side of things, that's where a therapist is more
yeah,
appropriate to handle it, and
yeah,
so it's both of those areas that need support, that you can handle one side and that person can handle the other.
yeah, and I'm very thankful for all the therapists I work with
Yeah.
because I there's a lot that, like, I'm very happy to be like, "Okay, it's not something I'm qualified for," like, and then pass it to them, and I'm amazed by what they do,
Yeah,
so
no, and that, I mean, and
that's
that
amazing.
amplifies your work so
Yeah,
much, right? If you were missing that other side of the puzzle, you'd be
yeah,
like, well, these people aren't able to get the support, the full support that they need, because I
yeah,
can only do so much in one arena, and then the work needs to be done. And I think, it's like you're saying, it's the synergistic, right? Where you can do the work you need to do, then you hand the baton to the person that's going to take it a little bit farther, and then it's back to you. And it's kind of this dynamic relationship that really gets someone the support that's that's really comprehensive. And I think, unfortunately, within our healthcare system, we don't see this enough. I can't tell you how many, I keep going back to this, my internship experience, and even in my work as in private practice, eating disorder or not, the disinterest or like the lack of interest in other clinicians, primary care doctors, whomever, there was no interest in collaboration. I feel like it was like I'd call to touch base with them and be like, can we talk about so and so's care? And I would get like 10% of the people that I called back, right? And it's just, this is so important. And your experience is a good testament to that, that collaborative care is so valuable to be able to support someone in their journey. And I feel like I hit brick walls so many times because I'd want to talk to their psychiatrist. I'd want to talk to whoever it was in their lives to support and for the betterment of this client. And I just would get silence. And I'd be like, well, this isn't good. This isn't helpful. I want to help this person. So I'm grateful that you're saying that you have a healthy communication with the therapist, because
Yeah.
I don't know if you've experienced this, but it seems to be that, not everyone feels this the same way.
Yeah, I've definitely experienced that too, where I've reached out, not to therapists. All the therapists I've worked with have been like amazing. They're really good at like collaborative care.
Awesome. Yes, I love
And
that.
actually, I get a lot of my referrals from therapists, so I'm very thankful for
Awesome.
the
Yeah.
therapists that I work with. Sometimes I'm not hating, doctors are great,
Yeah.
but I'm like, sometimes it's with the doctors, and I feel like
Yeah.
because they're so busy, they have a lot going
Yes.
on,
Yeah.
that like I will try to reach out and I will not hear back,
Yeah.
or
Yeah.
I will try to reach out and give a heads up, be like, hey, when they're coming, can we like blind weigh? Can we do
Yeah.
this? Can we do that? And then they'll come back and be like, they saw my, like I saw my weight, and they told me I needed to, I once had a client that went to a doctor's. I messaged their doctor asking for blind weight. He went to the doctor's, they weighed him, and then also asked him if he wanted to see a dietitian for weight loss. And he's an eating disorder client. And I was just so upset because I'm like, that makes me so hard, because here I'm like sending my child off into the world, and they're coming back.
Yes, right. And hoping that, yes. Yeah. Well, I think that too. I mean, like you said, no hate to doctors. That's not the intent here, but it's more just like a lack of education
Yeah.
and communication, like you're saying, because I agree with that. I think therapists are operating from more of a holistic, more collaborative point of view, that this is something that is more common in the therapeutic,
Yes.
like clinical population, where that collaboration is valued. Doctors, you're right, they're busy, they have a lot going on, and but to the detriment of your client. How horrible, right? What a terrible experience when you put forth that energy to say, hey, like, this client is not interested in knowing their weight, and this is maybe the background a little bit, and then to proceed as they did. Like,
Yeah.
that's tough.
Yeah.
Yeah.
It's very frustrating. And like, I get sometimes, like, especially since I use primarily fax, I've learned now like fax and try to call, so to make sure that like they get it, because sometimes things can get lost as well. But I just, yeah, within the medical field, it can sometimes be a little harder, I feel like, to reach the medical professionals to get collaborative care.
Sure. Yeah. Well, and I also don't know what type of background or education. I know there's obviously like psychiatric education,
Yeah.
but I don't know what their education is in the world of eating disorders. So I'd be curious to actually look into that further, just so I could better understand, maybe
Yeah.
what preparation they do have in that. But I mean, if anything, maybe it does speak to the deficit that's not there because they're not getting the education that they need to handle. And maybe it was that specific doctor, who knows, doesn't matter. But either way, it's definitely an area that needs more support, I think, overall, as we spoke on earlier. And, understanding the importance of getting legitimate training in a specific field that is, I think, the most intense mental health disorder, because it's a physical health disorder as well. You would think that there would be a little bit more rigor there, but we can
Yeah.
hope in the future that would be the case.
Yeah, because I don't often fault the doctors. I fault that it's just within either like the system that
Yes,
people
totally.
aren't educated on it.
Yeah.
Especially
Yeah.
if you're somebody who's never experienced disordered eating or an eating disorder. How are you supposed to know that someone's going to react so poorly to
Oh,
something,
sure.
your weight or certain comments that are made? Like, it's just lack of education
Yeah.
that
I mean,
isn't
that goes for
provided.
nutrition too.
Yeah.
Yeah. I mean, doctors aren't given a whole lot of education in nutrition as well, So I mean, it's not just ED or mental health. It's all areas, that tend to, lose focus. So yeah, that's tough. But this is us bringing awareness to the need that is there. So I'm curious to know what your thoughts are around what would you constitute, and obviously there's no one size fits all, and I keep saying that just to be sure that we're not generalizing, but what would you say is proper nourishment for someone who's struggling with a disordered relationship with food? So maybe not so much eating disorder and diagnostic necessarily, but I think there's a large gray area of people based on upbringing, based on social media, that are struggling with disordered relationships with eating. So I'm curious to know what your thoughts are around someone who can start to bring more awareness to that and maybe start to address it. Obviously, seeking out professional support if they feel that that's appropriate for where they're at. I always want to be sure I mention that, but just within themselves, what can they do to get started?
Yeah, well, I mean, I definitely feel like knowing where you're getting your information from is like a very good start. Where, like, if you're following people on social media, making sure that they're qualified professionals and not just,
Sure.
some random person
Yeah.
online.
Yeah.
And that's definitely a good place to start. And then with to kind of fix disordered relationship with food, I feel like we need to kind of neutralize food and
Yeah.
not kind of view it as just one thing or another. Like not just view it as calories or macros, like kind of view it as a whole. And know that like the disordered food relationship with food can kind of vary, where like I have some people that are like on the clean your plate club where they'll
Yeah.
always have to finish it, and then like that I definitely feel like working with therapists and diving into like why do you feel that way,
Sure.
what is going on there, and listening to hunger and fullness cues, even looking into the hunger and
Yeah.
fullness scale, and just kind of educating yourself more on nutrition, I feel like can be helpful.
Yeah.
And as long as it's not becoming like an obsession, like knowing, okay, what do carbs do for you? What do
Yeah.
protein do for you? What does fat do for you? Versus like us viewing it all as bad. Like everyone's like, okay, except for protein, I feel like everything is villainized. But yeah, I definitely feel like neutralizing food and then
Yeah.
learning a lot of basic nutrition education. Like a lot of people don't know a lot. I mean, it surprises me sometimes because I feel like I don't know exactly what they're teaching when you're younger, but like just reading a nutrition label and knowing what it means,
Yeah.
I feel like can be helpful. Um,
Sure.
but knowing like, okay, just because it has XYZ amount of carbs does not make it bad for you. Okay, it just means
Sure.
it provides more energy. Like we
Yeah.
should maybe sometimes pair it with a protein or a fat to give you more stable energy depending on
Yeah.
like what you're going for.
Sure.
But I feel like starting with neutralizing your foods and then, yeah, knowing either decreasing social media time or knowing who you're following.
Yeah, yeah, like
Really.
get to the root of
Yeah.
it. Yeah. I appreciate that. I think education is huge, and I think so many of our issues would subside if we were to clear out all of the mixed messaging that's there, and we really started at a young age to teach everyone about like what you're saying, you know, what does a carb do to the body? Why is protein valuable? Why should we be eating fiber and fat, and how all of them are welcome to the table? And it's interesting because I feel like for me too, seeing generationally, with our age group, it looks differently than women who are in their 40s, 50s, and 60s, and that is so fascinating to me because you just know, okay, well, they were raised in the 80s and 90s, and so their approach or their beliefs is going to look differently than what we see now in 2025 or what we thought was healthy in 2010 and the 2000s. So it's just really interesting because I think that definitely gets to the root of reconfiguring, dismantling, neutralizing, like you said, the way we view food and looking at it through a different frame of mind, and then also doing what we can to weed out the individuals that are either misinforming
Yeah.
or don't align or don't make us feel good, limiting our social media use, and being willing to say, how is this affecting me? How is
Yeah.
this determining my choices? How is this influencing what I'm eating or what I'm not eating? Is it making me feel good? Tuning
Yeah.
into that part of our body. I think we don't do that enough. We don't listen to your body all the time, but we don't actually tune into what certain things are doing to us and what's making us feel a certain way. And I think that skill set is something that's kind of lost. And I think that could be really helpful for us moving forward to be a little bit more aware of the impact that all of this is having.
Yes, yeah, and kind of what you said, intuitive eating is definitely
Yeah.
a great place to kind of not start, but work towards.
Yeah. Yeah.
And there's like a lot of good workbooks and things on that as
Sure.
well. But like a good thing what you said is like sometimes people think intuitive eating is more of, okay, I'm just gonna eat cookies all the time.
Yeah.
But it's kind of like knowing what your body needs and what your body
Yeah.
wants as
Yeah.
well. So like if you want something, okay, have it, but then what is gonna help you make you feel better with it
Yes.
physically? Like
Yes.
if I had cookies all day, every single day, I would not feel great. I wouldn't
Right.
have a lot of energy. But
Right.
okay, maybe I have cookies, but then I want to have something on the side, like put a fruit or, like a jerky or something
Yeah.
on the side to
Yeah.
provide more stable energy. And paying attention to like, yeah, how you're feeling
Yeah.
is an important thing. And like one of my favorite things is like eat what you want, but add what you need,
Yes.
and to try to create stable energy. And not all the time I'm going to like want to be adding something nice with it. Like
Sure.
sometimes I just want chips, and okay, that's fine. I'll eat my chips and move on.
Yeah. Yeah.
But
Yeah.
like most of the time I try to practice eating what I want and then adding what I need with it to
Yeah.
help me feel better. And I try to preach that with my like clients as well, no matter who they are, is like, okay,
Yeah.
if you want it, we're gonna have it. We're just gonna portion and we're gonna put things with it to make more stable
Yeah.
energy.
Yeah. Yeah. I love that. I think that's a perfect marriage of honoring the fact that you want a cookie, right?
Mhm.
And like you said, that's not something we're taught. Is you and I both know that having cookies all day long would not make us feel well. And not in like, oh, I feel so guilty that I did that, but in a like physically, I would not feel well because of what physiologically is happening in the body, but also it's just a lot of sugar and it
Yeah.
would just not feel good, right? Anyone
Mhm.
could say that. So it's about understanding. It's not about, oh my God, this had so many calories in it, or this is bad, or, whatever the case is. It's just about knowing logically, you know what? This is not going to make me feel my best. And so,
Yeah.
how can I be more strategic here about moderating how much I'm having? Like you said, adding in the things that my body's asking for, that my body needs to provide more stable energy, to promote satiety, or whatever the case might be. And that really starts with the education, knowing what those foods are, right? Knowing that protein and fat and fiber and things of that nature are going to help you. But
Yeah.
that education's just not there. People aren't looking at things that way. They're looking at it as like, oh, this has this many calories or
Yeah.
whatever the case is. And it's like, that's the most liberating thing that we can do by understanding that all of these things, the seed oils, the French fries, the whatever it is, they can be a
Mhm.
part of a healthy, balanced lifestyle. It's just about knowing how to go about it in a way that's going to help your body feel the best. And
Yeah.
that's really what it's about.
Yeah, and it's learning too, because like since I am a runner myself, I like to sometimes have like dessert first thing in the morning before a run because it's
Yeah.
quick carbs.
Yeah.
And so I know like, okay, if I have this whole big breakfast before a run, it's gonna slow digestion. My stomach might not feel as great, so I know I need quick carbs. And
Sure.
sometimes for me, that's like an Oreo,
Yeah.
and that's
And
sometimes when
then
I do
off to
that.
the races.
Yeah, exactly. Or like
Yeah.
I one time when I was doing like I think it was before my first marathon, I did like this 20-mile run and I was just starving, and I bring fuel when I run. So I fuel every few miles, but I really did not want another goo. So I
Yeah.
think I went to the local library. Usually I buy like an iced tea, but this time I think I bought like this little mini Pringles, and I'm running and just eating Pringles while I'm running. And people are like, what are you
Yeah.
doing?
Yeah. Well, it works, right?
Yeah, I wanted the
Yeah.
salt, I needed the carbs.
Yeah.
So I'm like, this is something that like it's gonna help me get through the last 5 miles of my
Yeah.
20-mile run.
Yeah.
Like
Yeah.
I
Yeah.
if it does the job,
Yeah.
and
It
that's
does
not
the
a
job.
time
Yeah.
when I need to be pairing it with a protein or need to be pairing it with a fat
Sure.
or a
Because you
fiber,
need it.
because
You're putting the
I need the
glucose to
energy.
work. So it's, yeah. Yeah. Right.
Yeah.
Okay. Very cool. Yeah, I love that. I think that that's huge. So I appreciate that take because obviously there comes some boundaries when it comes to ED that need to be maintained. But I think just generally speaking, becoming informed and understanding food in a way that you may have not otherwise understood it can be so helpful to understanding how to fuel properly, to nourish, and then also feel comfortable saying, yeah, like I'm going to have this cookie, or I'm gonna have, like you said, the chips and the guac and whatever. It's Cinco de Mayo, right? Like we can, whatever, right? Having these things just because you want to, and life is short, but you also know how to nourish alongside it,
Yeah.
and finding that balance. Even though it's cliche, it's so
Yeah.
true. There's so much value to that.
Yes.
Yeah. Okay. Awesome. So, anything else you feel that the audience needs to know, that you want them to know? Anything else?
I mean, I guess I'd just say like if you someone or if you're struggling with anything with disordered eating or eating disorder, to make sure that you find yourself a team of
Yes.
like
I love that.
therapist, a good doctor, yeah, good therapist, good doctor, good dietitian, and like know that
Yeah.
there are people that can like understand and can help. And it
Yeah.
depending, of course, on who it is, they may not need the full team, but at least
Yeah.
starting with a therapist or a dietitian can be like a great
Yeah.
way to start to kind of.
Yeah. Yeah. I appreciate that. I agree with that. And I feel very passionate about this, and coming from someone who is a former mental health therapist and sitting with someone who is a current registered dietitian, really leaning into the importance of having collaborative care. I think being able to speak from your experience and then knowing what I know, having this background, I would encourage you to really be vocal about that and having that open line of communication so that you can get the best support that you are looking for and that you need. And if in fact it becomes a roadblock for you, then maybe searching elsewhere and finding someone who is a little bit more willing to be more collaborative with your other supports so that you can really get to a point where you feel that you've made progress and that you're healing along your journey. I think that's hugely important, and it's up to you to vocalize and to be an advocate for yourself
Yes.
along the way. So I
Yeah.
wanted to be sure I mentioned that too, building off of what you said.
Yes. Yeah, that's kind of
Yeah.
good what you said as well, because making sure that I've had people that sometimes will either bounce therapists, or when they come to me, I'm like, if you feel like we're not a good fit, like please
Yeah.
let me know and I'll give you referrals to other dietitians.
Yeah.
It's important, especially in the disordered eating and eating disorder community, and especially in the mental health community, anything
Yeah.
not eating disorder related, that you feel comfortable and that you feel like you connect with
Totally.
your provider. And
Yeah.
so if you don't feel that way, like you got to find somebody
Yes,
else.
you can date around when it comes to your therapist, when it comes to your
Yeah.
RDs, there's no offense taken, at
No.
least in my personal experience.
I
It's more
agree.
like if you're not vibing with them or you feel that you can't connect, or I mean, I would say give it a chance if you are
Yes.
willing, but if you're really not feeling it, then that's okay.
Yeah.
You're welcome to move on, and it's not, you're locked in, or the therapist isn't going to, or the dietitian isn't going to be offended. It's just
Yeah.
about you're feeling comfortable being honest and really open to 100% of the experience. And that's where you're going to get the most out of it. So being open to that, I think, is huge. And being willing to say, yeah, I feel 100% confident in my space with this person in this relationship, that will get you the best outcome. So
Yes.
definitely important. All right, great. Well, Brianna, this has been so lovely and so wonderful to be able to, have this conversation and kind of hear your side of the work that you do, and being able to sprinkle in some of my experience and what I've learned along my journey. Even though it was short lived, I still feel like I learned a whole bunch about this work in doing so. So I appreciate you being here. Can you share with everyone where they can find you?
So I'm on Facebook as Nourish and Flourish Nutrition Therapy, and then also Instagram at Nourish and Flourish Nutrition, and then my website is nourishflourishnutrition.com.
Okay, awesome. I'll put all that information in the show notes so everyone can link it directly there so they can get to you easily. And this has been so lovely. So thank you again for being here, and thank you to everyone for tuning in. I hope that you enjoyed, and until next time, be well.